Hello everyone, welcome to the Total Joint Hip and Knee class. My name's Sam, I'm a nurse practitioner. I work here at Grant at the Bone and Joint Center. This is our class agenda. We're going to talk a little bit about what a joint replacement is, and then a main bulk of class is what to expect. We'll talk about before, during, after surgery. So you may have heard your surgeon refer to your joint replacement as a knee arthroplasty, hip arthroplasty. It's just the medical term used to describe your joint replacement. The surgeons will use implants to resurface the damaged bone and cartilage that you have either in your knee or your hip. And typically this is reserved for patients with severe arthritis like yourself. A lot of times patients will have to go through conservative measures such as physical therapy, joint injections. Sometimes they'll use braces, and now you're to a point where you've failed all the conservative measures, so that's why you're here for surgery. So for those of you that are having a total knee replacement, this is a picture of what the total knee components look like. The green arrow is pointing to the thigh bone component, or we call it the femoral component. The red arrow is pointing to a little plastic bearing, a little plastic piece that goes in between the metal implants. This kind of acts like the cartilage that you no longer have in your knee. The purple arrow is pointing to the shin bone tray, and that supports that plastic piece. All of the implants are made out of a metal alloy and a medical grade plastic piece that I had mentioned earlier. For those of you that are just having a partial knee replacement, or we call it a uni knee, very similar to the total, but it's just the one side of the knee that you have your arthritis on, either on the medial side or the lateral side, inside or outside basically. The green arrow, again, is the little thigh bone component. Again, there is a plastic bearing piece that goes in between. We call it a poly that acts like a cartilage that you no longer have. The purple arrow is pointing to the shin bone tray, and again, that supports the plastic bearing piece. So very similar to a total knee, it's just half of it. And then for those of you that are having a total hip replacement, this is a picture of what the total hip components look like. The purple arrow is pointing to what we call the cup, or that acetabular component that fits into your pelvis. The surgeon will normally use a screw or two to secure that into your pelvis. The red arrow is pointing to a little plastic bearing, again, a little, we call it a liner that goes in between the metal implants. And again, this acts like the cartilage you no longer have. And then you also will have the green arrow is pointing to the femoral component, which consists of the femoral head, or we call it like a ball, and a femoral stem that fits down into your femur. So this is just an overview of what the total hip components will look like. Now we're going to talk about preparing for surgery. So the most important part of getting your surgery is getting your preoperative medical clearance or pre-admission testing. It's the most important part of having surgery because without getting medical clearance, you're not going to have your surgery. It'll get postponed. Typically, our preoperative medical clearance appointment is performed by our Gen Med consultants at Grant at the Bone and Joint Center, or you could also go to your PCP. We need to make sure you're medically stable and safe enough to undergo anesthesia. So some of the things they will do at that appointment, they will do an extensive history and physical, they may take urine sample, they will do blood work, and depending on your health history, they may do a chest x-ray or EKG. And then sometimes it may require specialized clearance, such as cardiac, pulmonary. So if, let's say, you have an extensive heart history, they may have you go see your cardiologist, have them send us back a letter saying you're safe to undergo anesthesia. Any incomplete testing can cause delays or cancellations, so it's really, really important that you make it to that preoperative medical clearance appointment. So at your appointment, you want to make sure you talk to the doctor about your medications, and they will let you know what you should take before surgery and if you have to stop certain medications. It's really important that you take the medications that you're directed to morning of surgery and that you stop all the medications that you're instructed to. I have had patients that go to their pre-admission testing, they get cleared, and then they forget to stop a certain medication prior to surgery, and unfortunately their surgery got postponed. So it's a good idea, maybe write yourself a note, put a reminder in your phone to stop a certain medication. That way your surgery doesn't get postponed. If you're running low on any of your normal medications that you take at home, maybe call your PCP ahead of time. Let them know, hey, I'm having surgery next week. I'm running low on my blood pressure medications. Can you send me in a refill? That way you get all of your errands done prior to surgery and you have plenty of medication when you get home. Okay. So as far as preparing for surgery, you want to make sure you drink plenty of water at least a week prior to surgery. That way you're well hydrated. On your total hip and knee replacement patient guide on page 8, you can actually start practicing. They're called ankle and quad exercises, just to give you an idea what you'll be doing post-op. So also preparing for surgery, we want to make sure you stop eating solid foods 8 hours before the time you are scheduled to arrive to come to the hospital. So 8 hours prior to you coming to the hospital, we ask that you stop eating food, candy, mint, gum, tobacco. We are allowing patients to drink clear liquids until 2 hours before coming to the hospital. Clear liquids include water, Gatorade, Powerade, black coffee, plain tea. We just ask that you don't put any cream in your coffee or drink like a protein shake. So clear liquids you're allowed to drink until 2 hours before coming to the hospital. So if you're scheduled to arrive at the hospital, let's say at 8 o'clock in the morning, you can drink clear liquids until 6 a.m. Okay, so 2 hours before. If you smoke, we encourage you to quit smoking at least a couple weeks prior to surgery, and then continue quitting post-op. So smoking, as you know, can cause breathing problems, and it actually increases your risk of medical complications after surgery, and it can slow wound healing. So smoking decreases blood flow to your incision, so that can compromise your wound healing. So we always encourage patients to quit smoking a couple weeks before surgery and then continue to quit after. It's important for you to be honest with your healthcare provider about any alcohol use, letting us know honestly how many drinks per day, per week. It helps us determine if you're at any risk for alcohol withdrawal after surgery. I've had patients in the past that aren't upfront and honest with their healthcare provider about how much alcohol they use and have experienced post-op complications. So, we're not here to judge you. We just want to make sure you get the best care after surgery. We can give you special medications to prevent you from going through alcohol withdrawal. So it's really important that you be honest to your healthcare provider about any alcohol use. This also includes if you take medications that aren't prescribed to you, that can be a safety hazard. So like I said, honesty is the best policy. We're not going to judge you. We just want to make sure you get the best results after. As far as what to bring for surgery, you want to make sure you bring all of your insurance cards, bring your photo ID. If you have an advance directive or living will that you'd like us to have on file, you can bring that in and we can scan it into our system. Bring a list of medications if anything's changed between pre-admission testing and surgery. You want to wear a good pair of walking shoes in, comfortable, loose-fitting clothes. That first day after surgery, our therapist will get you back into your normal clothes. That way you're not in a hospital gown while you're here and get you ready to go home. We ask that you do not bring any of your home meds with you. We have a full pharmacy here that will be providing you with your medications, and this is just a safety issue. We don't want you taking your home medications and then us giving you medications on top of it. There can be some errors, so we just ask that you leave all of your medications at home. If you wear a CPAP or BiPAP machine for sleep apnea, you can bring that in and wear that at night. We ask that you just leave your valuables at home. Don't bring in excess money, jewelry. Just bring only what you need. You just need an overnight bag. So as far as your arrival time, the surgeon's office will call you at the latest the day before to let you know what time to arrive. Our surgery schedules sometimes don't get finalized to the day before because we have add-ons, cancellations. So they won't know the exact time until the day before. At that time when they call you to let you know what time to arrive, if you have any changes in your health history, such as you develop a cold, a rash, an infection somewhere, make sure you let them know. I had a patient last summer that was scheduled for a knee replacement, and they came in and they had poison ivy all over their knee. And unfortunately, their surgery got postponed. So any changes out of the ordinary, make sure you let the surgery scheduler know, and they can talk to the surgeon and determine if you're okay to proceed with surgery or if it needs to be postponed. Day of surgery, you can brush your teeth. If you do have to take medications morning of surgery, make sure it's with water or clear liquids as instructed. You can wear your dentures, glasses, hearing aids, and that's fine. So after you valet park, you're going to check in at the front desk where guest service liaison will direct you to the second floor waiting room. Once the pre-op nurse is ready to come get you, they will take you back to the Preop Bay. This is a picture of what our pre-op bays look like. This is where you will sign your consent for surgery if you already haven't. Again, the nurse will review your health history, going over your medications, allergies, and then if you need any additional testing, they'll do that in the pre-op bay. So if you need your blood sugar taken, EKG, certain medications, they'll do that in the pre-op bay. Okay. So while the nurse is getting you ready, your anesthesiologist will come in and talk to you about your different anesthesia options. Anesthesia options are based on your health history, what the anesthesiologist determines is safe, and what your surgeon orders. So just to go through a few different varieties of the types of anesthesia we do at Grant. General anesthesia is where the anesthesiologist gives you medication through your IV. You will be asleep, they insert a breathing device and monitor you throughout the case. That's called general anesthesia. Another type of anesthesia that they may offer, it's called spinal anesthesia. It's where the anesthesiologist will use a little needle and inject some numbing medication in your back, and it helps numb up your legs after surgery. Spinal anesthesia can last sometimes 12 hours up to 24 hours, and it helps with post-op pain control. It allows you to take less narcotics after surgery, and it's something that they may offer to you. Another type of anesthesia that they may discuss with you, especially for our total knee patients, it's called a regional block, very similar to the spinal. It's where the anesthesiologist will use an ultrasound and map out your nerves in your leg, and they inject numbing medication around those nerves, and again, it helps numb up your leg after surgery, and it can last anywhere from 12 to 24 hours. Again, it does allow you to take less narcotics after surgery, so it's something to consider, and they will go through risk benefits. They'll go into depth when the anesthesiologist is talking to you. Also in the pre-op bay, the pre-op nurse will insert an IV and start giving you fluids and medication that your surgeon's ordered. So after anesthesia sees you, your surgeon will come in and talk to you and answer any last-minute questions. When the OR team is ready to come get you, they'll take you back to the OR. This is a picture of what the surgical team will wear. They almost look like spacesuits. The OR is a sterile environment, so we like to have everything covered and it's nice and clean. So you may see staff wearing those. They're called togas. And again, it is rather cold in the OR, so with the surgeons and staff wearing these togas and under the OR lights, it can get kind of hot. So they like to keep it nice and cool back in the OR, but one of the first things our nurses will do is grab you warm heated blankets. It's not unusual for there to be several people back in the OR. Everybody has their own specific job, so if you do remember going back to the OR and seeing that many people, don't be worried or concerned. After they get you to the OR table, they'll give you warm heated blankets, and then the anesthesiologist will connect you to a heart monitor, so they'll put little sticky pads on your chest, have you start breathing oxygen, and then they will proceed with giving you your anesthesia. So surgery typically takes anywhere from 1 to 3 hours. It just depends on your surgeon and the procedure that you're having done. After surgery, you wake up in the recovery room where a nurse will be observing you closely. They take vital signs every few minutes, monitor your breathing, assess your pain levels. So you'll be in recovery for about an hour or so. You will wake up with nasal cannula in your nose that helps supply supplemental oxygen, and it monitors your breathing patterns after surgery. Normally, patients will wear nasal cannula in their nose at least overnight, and as long as your oxygen levels are good, they'll take it off that next morning. If you could let your family members know, it could be anywhere from 4 to 5 hours before they see you. So with surgery lasting anywhere from 1 to 3 hours, your family will be able to visit you after you're recovered and upstairs. So it could be anywhere from 4 to 5 hours before they see you, so let your family members know. So you may wake up, depending on your procedure and your surgeon, post-op drains, knee braces for certain docs with total knee replacements, hip abduction pillows, like the picture shown for a posterior approach of a total hip, and then a bag of ice either on your hip or your knee. We use a lot of ice here at Grant, so you will wake up with a bag of ice on either your knee or your hip. You also may experience a little bit of a sore throat following surgery. Just let your nurse know if it's bothering you too much, and we have throat sprays and throat lozenges we can give you. So right after surgery, your surgeon will call and meet with your family to discuss how the surgery went. You will be in the recovery room until you're stable to be transferred to your inpatient private room. All of our rooms are private here at the Bone and Joint, so you'll have your own bathroom. Your family will be able to visit you once you are upstairs in your room. So you will have a lot of healthcare workers providing care while you're here after a total knee or a total hip replacement. So obviously we have your surgeon, but we also have physician assistants and nurse practitioners that specialize in orthopedics. We have orthopedic residents that may be helping with your care. We have a medical physician group that we consult on all of our patients. They're called HMS, and they manage everything medical. So they will be monitoring your blood pressures, blood sugars, listen to your heart and lungs. Anything medical, they will manage. Obviously, we have nurses that will be taking care of you as well. PT and OT. So PT stands for physical therapy, and they will help you show you your exercises, get you up walking, practice steps with you. OT stands for occupational therapy, and they help with activities of daily living. So they'll help get you back into your clothes that next morning. They'll show you how to get around the bathroom. Any activities of daily living they will show you how to do. Our social workers, case managers, they assist in discharge planning and help you with either your outpatient therapy or your home health. We have orthopedic pharmacists that will be monitoring all of your medications, lab work, and they will actually educate you on all of your new meds prior to discharge. And then we also have your family. So everybody is an integral part to your healthcare team while you're here. So right after surgery, the type of dressing that our surgeons use, it's called an aquacell dressing. They are waterproof and they are antimicrobial. So they have silver impregnated in them, so it keeps all the bad bacteria out. Typically, the surgeons will have you wear this at least for 7 days. Some surgeons vary, but like I said, it is waterproof, so you can shower with it on. So just so you're aware, our night shift nurses take vital signs throughout the night, and they do blood draws pretty early each morning, so you're probably not going to get the best rest overnight while you're here. Most of our physicians do rounds in the morning, and we do multidisciplinary rounding. That means the surgeon will round with a physical therapist, case manager, pharmacist, and either a nurse practitioner or physician assistant. Both therapies, physical and occupational therapy, will see you until you meet your goals. Our nurses give shift report at 7 and 7. They do bedside reporting, so that means both nurses will come in, talk about how your day or night went, look at your dressing, talk about any issues that they had during the day or night. All of our rooms have this whiteboard that's a good communication tool between our healthcare providers. So our therapists will write down how far you're walking. For our total knee patients, I'll write down what your range of motion is. And then also our nurses will write down what pain medication you're getting, when you had it last, and when you can get it again. All of our pain medication is ordered as needed, so you do have to ask for it. So it's just a good visual tool for patients to see that I had my dose last at 8 o'clock, and I can ask for it again at noon. I'll call my nurse, around 11:30 to ask them to bring in my meds. So right after surgery, you'll be started on a clear liquid diet, and then they will progress you to a regular diet as tolerated. You want to make sure you let your nurse know if you're feeling nauseated or if your abdomen feels full or distended. Something that can arise after a major orthopedic surgery is developing pneumonia. So a couple different things to prevent you from getting pneumonia. First and foremost, working with therapy, getting up walking, changing positions while you're in bed, sitting up in a chair, doing coughing, deep breathing. And then also using this incentive spirometer. This is a breathing exercise that our nurses will show you how to do. You take really big, deep breaths in, and it prevents any bacteria from settling in your lungs. The nurses will show you how to use this post-op. I always encourage patients to use this at least 10 times an hour. Or I tell patients, if you're watching TV, maybe during every commercial, do it a couple times. That will equal your 10. Also, something that can arise after a major orthopedic surgery is developing what's called a DVT or a blood clot. The risk is relatively low, but our surgeons take it pretty seriously, and they'll have you do a couple different things to prevent you from getting blood clots in your legs. One thing that the surgeons will order, they're called elastic stockings or TED hose. They go all the way from your toes up to your thighs, and they help with compression, they help with swelling and circulation. So you will go home with these TED hose, and we'll have you wear them for 2 weeks. Normally we tell patients you can keep them on during the day, you can take them off at night to just wash them, let them air dry, let your skin breathe, but for the most part you're going to wear those for 2 weeks. And then also while you're here in the hospital, while you're in bed, you will be connected to compression boots or pumps on your legs that are connected to a machine, and they pump up every few seconds and give your leg a nice massage while you're here. And again, that helps with circulation and it prevents blood clots. Also, while you're here, you will be started on either a tablet or an injection to help thin your blood. It's really important that you take this medication as prescribed. You will receive the medication here, and then we also send you home with a prescription to take at home. So you will receive medications during your hospital stay, and you will get new prescriptions at discharge. There's a couple different ways we can give you your prescriptions after you discharge. We can send them to your usual preferred pharmacy, or we can have our grant pharmacy here deliver your medications to your room prior to discharge. This is a new program that we've started. It is important, though, that you have your insurance card and a payment available if you have any copays. You may have some out-of-pocket costs, but it's no different than us sending your prescriptions to your preferred pharmacy. The only difference is you have your prescriptions with you before you go, which is great. So pain control after surgery, it is normal to have surgical pain after a major orthopedic surgery, but just so you know, we will try and make you as comfortable as possible. To completely get you pain-free would cause some unacceptable side effects, such as stopping breathing, can cause nausea, vomiting, urinary retention, constipation. So just so you know, we will do everything we can to make sure you're comfortable, okay? Considering that spinal or regional anesthesia can provide some extra pain control, your healthcare team will order the pain medication that's best for you, okay? Your pain medication will be customized to you and your surgery specifically. Narcotic pain medications are high risk and they are extremely regulated, so we do ask patients to safely and securely store your narcotic pain medications after surgery at home. We ask that you do not have pain prescriptions written by more than one provider at a time. And narcotic pain medications after a total hip or knee replacement, it's meant to be short-term use that you will taper down as the time goes on. A good website that patients can utilize for prescription cost, it's called GoodRx, and it's a website and it's also an app that you can get on your phone that can help you pay less than the cash price from your prescription. I have a lot of patients that will use this. There are certain medications and insurances tend to not cover as much, so you can get on this GoodRx app or goodrx.com, type in the medication, and you can see if you can get a coupon. So I have a lot of patients that will use this for their prescriptions post-op. Also, something that can potentially happen after surgery is constipation. So with anesthesia and narcotic pain medication, it can cause some constipation. So a couple different things to help prevent constipation. Increasing your fluid intake, increasing your dietary fiber, and then also using your laxatives and stool softeners as prescribed. The best thing to help with constipation prevention is getting up moving, working with PT. Now I'm going to have a physical therapist come in and talk to you about your physical therapy goals. Her name is Lori.
Hi, my name is Lori. I'm a physical therapist on the Bone and Joint Center. We have a whole team of therapists that will help you after your total joint surgery. One big thing that we want you to know right away is that you'll be getting up out of bed after your surgery really quickly. So you'll come up from the operating room to the recovery room to our unit where you'll be staying overnight, and that's when we start working with you. So within a few hours, you'll be up on your leg and walking on it. You'll be allowed to weight bear through it. You'll be allowed to walk, and that's what we'll do as soon as you're awake and alert and can participate with us. The goals that we have for you by the time you go home with both physical and occupational therapy are for you to be able to get in and out of the bed on your own or with maybe a caregiver at home. We want you to be able to walk up and down the hallway safely. Wheeled walker is the most common device that we use. We want you to be able to go up and down any stairs that you have at home. So if you have a full flight of stairs, we'll practice that. If you've just got a couple steps to get into your front door, we'll practice that. Railing, no railing, we simulate what we can. to make it so that we are assured that you can get home and be safe and get in the house. Occupational therapy, like Sam said, they really work on being able to be independent in the bathroom and to be able to bathe and dress yourself and do the things that you normally would do at home as you're recovering. For physical therapy, the main thing after a knee replacement is to get the motion back in your leg, and that's really the primary thing that the doctors are concerned with. So by the time you go back and see them in the doctor's office, we want you to have a full straight knee and a bending of your knee to about 90 to 100 degrees. We'll make sure you know what that means. We go through a set of exercises for both hip and knee replacement patients, and we'll make sure you know those too. We give you a handout for your exercise program at home. For hip patients, the motion is not the important thing like it is for the knee. It's actually being able to follow precautions that we have for you so that that hip stays in place and heals nicely. It's just the opposite of a total knee replacement. We do two types of hip surgeries here at the Bone and Joint Center. There are different surgical approaches. The first one is an anterior approach, and then there's also a posterior approach. So it's just to the front of the hip joint or to the back of the hip joint. We do both of those, but they mean different things. So I want to show you here the anterior hip replacement is the only thing that you're not allowed to do after that is to basically do what's in the picture. It's a warrior pose. You don't want to bring your surgical leg way back behind you because the incision is in the front of your leg, and so you want to make sure and protect that incision and don't stretch that hip over the front of your joint. So basically, if you have an anterior approach to your surgery, no yoga, no warrior pose. Fairly simple. Now, if you have a posterior hip precautions, which is when you have a posterior approach to your hip surgery, there's 3 different things you're not allowed to do. We don't want you bending past 90 degrees, so no reaching basically past your knee. We don't want you to cross your legs, and we don't want you to twist at your hip. So anytime your surgical leg is crossing the midline of your body, that puts you at a risk for that hip to dislocate as it's healing. The incidences are very low for this, but if you follow these hip precautions, you'll be fine. So just make sure no bending past 90 degrees, no twisting, and no crossing your legs for about 6 to 8 weeks, depending on what your surgeon tells you. We also don't want you sleeping on your side if you had a posterior approach, because that tends to make it so that you would cross your legs in your sleep, and that's one thing we want to avoid, of course. So anterior, posterior hip approaches. Your surgeon, if you're a hip replacement, you're going to have one or the other. We'll make sure you know what you've had done, and then we'll also make sure that you know those precautions before you go home so that you're safe and heal well. This is a picture of the posterior hip precautions, exactly the things I just said that you're not allowed to do. Just another example, no bending, no crossing, and no twisting. Just a visual aid for you to look at. Okay, back to our knee replacement patients. So like I said, the motion is the top thing that we're worrying about for you to make sure that you don't lose any motion as you heal. Scar tissue develops in there pretty quickly as you heal, so you've got to make sure every day that you're going through the motion. We want to make sure that you're getting a nice straight knee, and that's the picture in the top left. We're measuring that leg. It's called a goniometer. This is the measurement device that we use. We've got your leg up on a roll there, and that's just making sure that knee's going nice and straight, and we measure and make sure you're getting the full motion in it. The picture at the bottom is just where you're bending your knee, and we want you to have at least that 90-degree bend or more by the time you leave the hospital, and then especially at the 2-week appointment when you see your surgeon. So just be prepared for our knee replacement patients to have a set of exercises and our hip replacement patients to have a different set of exercises to do as you heal. It'll just make you be more functional in the end. It'll make your total joint replacement completely worth it. I want you to know, too, that the occupational therapist, the morning after your surgery, when you're getting ready to go home, will have you bring a set of clothing with you, something that's like loose-fitting, easy to take on and off, that the occupational therapist will actually help you get dressed that morning after your surgery. And by them helping you do that, you'll know the easiest way to do it and the best techniques to do it to take care of your joint and reduce the pain for you as you're doing that kind of stuff. So this picture is just at the bottom right is just a picture of a device that you can use to help you get your pants on. It's a reacher. We have other devices that you can use too. We have a sock aid, we have a long-handled sponge, and other things we can show you. There are some options for you if you need help getting dressed and bathed in the mornings. So We just want to make sure by the time you go home that you've seen the occupational therapist and physical therapist and have reached all the goals that we have for you so that you can go home safely and successfully. We all dress in maroon if we're a physical therapist or an occupational therapist or even a speech therapist in the hospital. So whenever you see maroon, you'll know that therapy is on its way to see you, and we are really glad to take care of you and enjoy your stay with us. We're looking forward to seeing you.
So as far as your discharge planning, your discharge plan will be reviewed by a case manager or social worker. Typically, our length of stay after a total knee or a total hip replacement is just 1 day, so that would be an overnight stay, and our goal is to get you home. Patients that go home are generally more comfortable in their own home. They're less likely to develop an infection. We also recommend that you have family stay with you at least 24 hours up to 72 hours, just so that they're available to help you with any of your needs. Also, something that you want to think ahead about is preparing your home, even prior to surgery. So this will increase your safety and it will increase your independence after surgery. So moving items maybe that you use every day from the countertop to the shelf, that way they're easily reached. Removing anything that you can trip on, such as a throw rug, extension cords. It might be a good idea to get some night lights for your bedroom or bathroom. And just remember that pets can be a tripping hazard, so just to be aware, your surroundings if they're around. Also, we always encourage patients to do cleaning, laundry, do all of your errands ahead of time. Also, prepare your meals ahead of time. You can freeze them. That way, when you get home, you're not cooking and you can just put them in the microwave and heat them up. Your discharge planning will include several different things. They'll include physical therapy, occupational therapy, your surgeon, case managers, social workers, you and your family. So plans can change based on how well you're doing with therapy. Just remember, you will progress every day. Insurance does play a role in discharge planning, but our case managers and social workers will work with your insurance to make sure everything is a safe discharge plan. After surgery, you will need a ride home from the hospital. You will need to ask a friend or family member to drive you to your follow-up appointments, or if you have any physical therapy sessions that you need to get to. Typically, we have patients stop driving anywhere from 2 to 6 weeks, and that depends on your surgery and it depends on your surgeon's preference. If you do decide to fill your prescriptions at your preferred pharmacy, remember you will have to have somebody pick up your medications the day you are discharged, because you will need your pain medication and also importantly your blood thinning medication. So as far as discharge plans, for our total hips, we will have a nurse come out to your house 1 time a week for 2 weeks, and they will assess your dressing. They'll assist you with removing your dressing and do any medication teaching. For total knees, we'll have you do physical therapy 3 times a week for 6 weeks. Some patients will go straight to outpatient physical therapy right after surgery. If you do have a ride, we do encourage patients to do that. Other patients that either don't have a ride to outpatient therapy or if their surgeon prefers it, we will do home PT 3 times a week for 2 weeks and then transition you to outpatient. Just to reiterate what Lori, the physical therapist, had mentioned, for our total knee patients, a goal for you at your 2-week follow-up appointment is getting your range of motion from 0 to 90. So as far as your medical equipment, our total hip and knee patients will need a front wheeled walker. Typically, all insurance companies will cover the cost of this if you have not received one in the last 5 years. Total hip patients, we encourage you to get an elevated toilet seat, shower chair. Unfortunately, only Medicaid products cover a shower chair. And then also a hip kit. Hip kits aren't covered by any insurance, but you can get them from retail pharmacies such as like a CVS, Target, and then also you can find them on Amazon or ask around friends, family, neighbors that potentially have had a hip replacement in the past. They may be able to let you borrow them. Again, for total hips that are anterior approach, You do not need a hip kit because you do not have any precautions as far as bending down. So at home after surgery, it's important for you to take your pain medications prior to any PT sessions. This allows you to maximize your time with PT and you're not in so much pain you can't complete your exercises. So I normally tell patients maybe an hour or so before your physical therapy session, maybe take your pain medication. That way it's working well into your physical therapy session. Try and eat nutritious meals after surgery. That will help with wound healing. You will need to take medications that are prescribed by your surgeon. Most importantly, your blood thinning medication to prevent you from getting a blood clot, and taking your pain medication as prescribed. Make sure you read your discharge instructions. There's a lot of good material in there that talks about your activity, follow-up appointments, medications. So it's all in there. So make sure you read those even after you leave the hospital. You will have to take antibiotics before certain procedures, such as dental care, for the rest of your life. This is a lifelong precaution that our orthopedic surgeons will have you do. So down the road, let's say 6 months after your total knee or hip, if you schedule a dental cleaning, just call your surgeon's office and they will electronically send you in a prescription for an antibiotic. The theory behind this is during a dental cleaning, you have bacteria in your mouth, obviously, and there's always a potential that that bacteria could break off, get into your bloodstream, and then it could potentially get to your new joint. So that is the rationale behind this. So I always tell patients, remember, before going to the dentist, call your surgeon. They will send you an electronic prescription for an antibiotic, and a lot of times they will give you extra refills. They will talk more about this at your follow-up appointment to remind you. So as far as at home with your incision, it's normal to have just a small amount of clear bloody drainage from your incision. That's normal. You may also just experience some swelling, bruising around your new joint. And again, that's fairly typical after a major orthopedic surgery. As far as, again, your incision care, you want to make sure you keep your incision clean and dry. You can shower. After that Aquacel dressing is removed, you can gently wash your incision. Just use mild soap and water. We ask that you don't scrub on it. And we also ask that you don't use any powders, creams, ointments, lotions anywhere on your incision until you get your doctor's approval. And we also ask no hot tubs, tub baths, or swimming, again, until you get your doctor's approval. So things to manage your swelling. It is common for your incision and leg to have swelling after orthopedic surgery. So a couple different things to prevent you from swelling too much. So elevating your legs up above your heart, wearing those compression stockings that I'd mentioned earlier. They're called TED hose. During the day, you can take them off at night to let your skin breathe. If you need to wash them, let them air dry. And then ice frequently. Plain old bags of ice work. We have patients that use frozen peas, frozen carrots, ice machines, gel pads. Any way you can ice your knee down, you want to do that several times a day. We just ask that you don't put the ice directly on your skin. Make sure you put a washcloth in between. So for our total knee patients, believe it or not, there is a proper way to elevate your leg after surgery. So our surgeons do not want you to place a pillow under your knee while you're in bed. So this can cause your knee to get stiff. So our surgeons, when you're elevating your leg up, we want you to put it under your ankle, and you may need to use 2 or 3 pillows to elevate your leg nice and straight, like this picture. So like I said, do not put anything underneath your knee while you're trying to elevate it. Make sure it's more under your ankle. That way your leg is nice and straight. So after surgery with your activity, we ask that you walk each day, gradually increasing your distance using your walker. We ask that you do not drive, play sports, use exercise equipment until you get your doctor's approval. And normally it's okay to resume any sexual activity when approved by your doctor. So big thing, call your surgeon for. If you notice any severe swelling, purulent drainage, that would be like a pus coming from your incision, you want to make sure you call. If you're saturating through dressings, you want to make sure you call right away. If you develop a temperature over 101, if the edges of your incision start to separate, if your pain gets worse and it's not controlled by your pain medication, and lastly, if you're experiencing signs and symptoms of a blood clot or a DVT, that would be calf pain, swelling that's not relieved by ice and elevation, any redness in your calf, make sure you call right away. Now, of course, if you get chest pain, shortness of breath, we want to make sure you go straight to an ER. But any issues surrounding your wound, make sure you call your surgeon's office. And if at all possible, try and call during business hours. A lot of times our surgeons can get you in that same day or first thing that next morning. Again, if you have any questions or concerns, remember to refer to your total joint replacement guidebook that you got from the office. Read your hospital discharge instructions that are provided from your surgeon, and also call the surgeon's office if you have any questions. Thank you for allowing us to participate in your care. We look forward to seeing you after surgery.